literal definition of pneumonia is a combination of an acute respiratory illness. And when I say acute, I mean short-lived. In other words, the patient was well up until a few days ago and then developed a classic range of symptoms which include fever, generally feeling unwell. They may appreciate some pleurisy. They'll have a cough. They may be coughing up phlegm, which is often purulent or yellow. And these symptoms in combination with a chest x-ray which shows new shadowing that wasn't previously known about or that doesn't have an alternative or known cause. In those circumstances, we would make the diagnosis of pneumonia. Pneumonia can be classified in a number of different ways. Firstly, you can consider where the patient contracted the infection. And in that context, you would classify the patient as having either a community-acquired pneumonia or a hospital-acquired pneumonia. Another way of considering pneumonia is to think about the type of organisms which can be either bacteria, viruses or fungi that are responsible for the pneumonia. You can also classify the pneumonia in terms of its severity, so not thinking about the organism as such or even where the patient contracted the infection, but just looking at the consequence of the infection in the patient and make a decision as to how serious the illness is that the patient has. And the majority of people, pneumonia can be a relatively mild illness, but as in many cases in medicine, patients can present with a spectrum of severity from mild to the life-threatening. To answer the question, what causes pneumonia, I think it's helpful to separate that out into two parts. Firstly, to think about the potential organism that the patient has contracted that's causing the illness. And then secondly, to think of it at the level of the lung. So dealing with the first area, the most common causes of pneumonia are organisms that come from either a virus, a bacteria, or more rarely fungal infections. Dealing with the second area, which is at the lung and airway level, I think patients and perhaps even some doctors get confused about what actually pneumonia is. And if asked the question, well, how does pneumonia differ, for example, from bronchitis? I think it's useful to think of it in this way, that bronchitis is in effect inflammation of the airway lining, and it can cause a cough and breathlessness and phlegm production and fever, and you can feel very unwell with this. However, pneumonia is different. Pneumonia is where the air sacs fill up with fluid, so the lung becomes consolidated or solid, and that's what you can see on the chest x-ray. So you get all those symptoms, but the distinguishing feature is that the air sacs fill up with inflammatory debris and fluid, and it's a more serious infection, and an infection that can lead to more serious consequences. So we always take it very seriously. To answer that question, is pneumonia contagious? I think the simple and very short answer is yes. It is an infection which is reliant upon host-to-host transmission, and therefore to be successful and to continue, it needs to be passed on from one person to another. However, the relative ease with which the infection is passed from individual to individual can vary dependent on the organism, but they all rely on this capacity to spread. The simple analogy is, and I'm sure many of us have seen the slow motion photography, watching somebody sneeze, and the velocity of the micro droplets that emanate out from the patient when that happens. If you can imagine that some of those micro droplets will contain bacteria or virus, then you can see how easily it might be that sharing a living space with somebody that has an infection of this type, how easy it is to either touch a surface which has the organism on it, or even to inhale microdroplets directly in the air. And in this way, infections spread from one person to another. It's true to say that the majority of patients that develop a lower respiratory tract infection, which is in fact a pneumonia, often don't get diagnosed as such and will contact their GP and complain of the common symptoms of breathlessness, cough, fever, mucky phlegm, sometimes pleurisy. The GP will make a clinical assessment and provide a course of antibiotics. And for the majority of these patients, that is absolutely the right approach to take. If the patient is sick enough to warrant hospital admission, and that decision is often made, or usually made, by the GP, then in these circumstances our approach is very different. We take a whole system approach. They have a formal assessment which includes a history, a clinical history, where we talk to the patient and understand the sequence of events that's led up to that day. We examine the patient and we arrange for a variety of tests. Firstly, imaging tests to confirm pneumonia, and then secondly, a variety of blood tests and sputum tests to assess the severity of the illness, its impact on other organ systems, and try to identify the causative organism. If we believe the patient has a viral cause, and the kits that we use will allow us to pinpoint exactly what virus, so it may be one of the subtypes of influenza, for example, then we would consider anti-influenza medication in the form of Tamiflu, for example. If, however, we believe this to be a bacterial infection, then the approach to treatment would be primarily antibiotics, and the type of antibiotic would be in part determined by the severity of the illness, and in part determined by what information we have initially as the potential cause.